Now, if you haven't heard of the coronavirus or been affected by it in some way, then you probably live on Mars, right? We're familiar with this virus under many names: the COVID-19, the flu, influenza, novel virus and all of that. But by all regards, it is a novel virus. Now, why is it called a novel virus? It's because we've never seen this virus before. We are familiar with the other strains of it, but this is the first time that we are seeing this particular strain of this virus, right? So what started off as an epidemic is now a pandemic of global proportions, right? This is the epidemic on steroids, you can say. And this isn't the first time that humanity has faced such a crisis, right? All throughout history, we've had epidemics and pandemics that have decimated as much as half of the living population, the world population at that time. For example, the Justinian plague of 541 AD, which lasted a year, is estimated to have killed as much as 25 million people. And in 541 AD, that represents half the world's population. This again showed itself during the 1300s, during 1346, all the way up to 1353 as the Black Death, and this is estimated to have had a death toll between 75 and 200 million people. And at that time, this was half of the population of Europe that just got wiped out because of this plague. Then more recently, there was the flu pandemic of 1918, where the death toll was between 20 and 50 million people. And we've had a lot of outbreaks more recently in the past as well, such as SARS, MERS, and all of that. But what has changed from the medieval times is the advancement in medical science and medical technology, which have helped us, realize these outbreaks, identify these outbreaks, and maybe to a certain extent even prevent them. But every once in a while, nature surprises us with something new altogether. And the coronavirus, this COVID-19, is something of that nature. Right? So this is a very critical time for the world that we live in because of a lot of factors, but more alarmingly, the rate at which this virus seems to be spreading. Right? And at times like these, there are a couple of factors which decide or pave the way forward, right? So let's quickly look at those factors. What is it that will determine the way forward? One is, how quickly does the virus spread? How soon can we find a cure or a vaccine or a solution for this? How equipped is the medical infrastructure in the country and also globally to deal with this pandemic? And lastly, how will the governments react to this situation? Now, let's look at them one by one, but the first one is, how quickly does the virus spread? Well, to be fair, it spreads very quickly. So if you look at the list of the most affected countries in the world, China, Italy, Iran, and all that, you see that the first 100 cases to be reported, they take a while. But the number of days it takes between the first 100 cases to be reported all the way up to the first 1,000 cases to be reported is alarmingly just 6 days. Right? In China, it was 6 days between the first 100 cases and the 1,000 cases. In Italy, it was 6 days. In Iran, it was 5 days. Now, the number of days it takes between the first 1,000 cases and 5,000 cases is just 4 days. And between 5,000 and 10,000 cases is 3 days. Right? So the first 100 to 200 cases, by the time a country or a nation detects those cases, this is crucial. Right? The steps that you take at that time will, to a large extent, determine the way forward. Right? As you can see, in all these countries, Between 100 cases and 1,000, it took less than a week. In order to reach 10,000, it took just another week. So in about 10 to 14 days, if the situation is not dealt with and contained properly, we could be at 10,000 cases in just 2 weeks' time, right? And in India, we're already at 500 plus cases. I believe that's the latest number that was reported on a couple of sites. No one knows the exact number because, well, some people might be living under the symptoms for a while before they realize it and seek medical attention. So at 500 cases, the next 1 week will decide the way forward and the fate of India. And the only way to go about this, the only way to break the chain, is to isolate yourself. Those who are affected and those who are not affected as well, right? Social distancing is the real solution here, and we need to treat it with the attention and the respect that it deserves. We can't go about our daily lives assuming that everything is okay when it's not. The second factor that determines the way forward is how soon can we find a cure. Now, with the coronavirus, there is no vaccine yet, and there is no cure other than living it out and recovering from it. But there is a solution to this, and that is called social distancing. And people think of it as a restriction, but in fact it's not. It's prevention, right? The most effective way for the virus to spread is where people are gathered together and there's constant contact between people. You deny the virus that chance, that opportunity, the spread of this virus is definitely going to reduce. So I think once again, we definitely need to understand the seriousness of the situation and take our health into our own hands, right? You have to distance yourself. Right now, all we know about prevention is stuff like washing your hands, making sure you take a bath if you've gone out and come back in, distancing yourself socially. In most of these affected countries, it was too late by the time they started taking preventive measures, right? But in India so far, an epidemic of insane proportions hasn't been reached yet. But that's not to say that it won't. Unless we decide to act proactively and act sensibly, this might as well just be the case in India, because we're already into the 500 range, and from here on, everything that we do absolutely matters. The next 10 days are absolutely critical to decide how the future is going to be. If we are reckless in our behavior, we might as well aid this virus in continuing its conquest of mankind. The other thing is, how equipped is the medical infrastructure to deal with this sort of an outbreak? Well, to be honest, if you think about it, our medical infrastructure isn't really equipped at all. The number of hospitals aren't designed to deal with that level of outbreak yet. A lot of you would have seen the news where it's being said that the number of masks are inadequate, there's lack of hand sanitizers, even for hospitals, and the number of ICUs throughout the country are definitely not enough to deal with an outbreak. So it is up to us, the citizens of the world, to act responsibly and not put additional and unrequired strain on the medical resources. I think this will definitely help, right? Another thing is, how will the nations and the governments react? If you see the prevailing situation, you know that it's already quite late. Nations haven't been as proactive as they once were. The United States, which normally is the leader in coming out with solutions and finding ways for countries to work together, is maintaining a social distance in this matter as well. It's sort of aloof, and so I think it boils down to individual countries, the governments of individual countries, to set a scheme for their own, like travel restrictions, forced lockdowns in the nation, and all of that. Now, apart from this, there's also something else that is worrying and is concerning, and it has to do with how technology might be implemented in this time to fight the coronavirus, but which could drastically impact the way we view individual privacy. If you've read the book Sapiens or a second part Homo Deus, then you're already aware of the author Yuval Noah Harari. And last week he published an article about the impact that coronavirus could have on governments and nations. In that, he talks about how governments have the potential to use technology such as connected technology, such as wristbands and all of that, to monitor the health of its citizens, thereby helping them to identify those that are high at risk of contacting the virus or those who have already contacted the virus, and monitoring them to make sure that they do not spread this disease further. Now it sounds novel and sounds very helpful, but the problem with such measures which are implemented in emergency situations like this is that they far outlast the emergency situation. And in the hands of a selfish government, this could impact the way you view your privacy. Privacy might no longer be private anymore, right? The link to that article is there in the description below, and I highly urge you to read it because it's quite thought-provoking and inspiring. Now, I think a country like India is safe from this because in a place where we still haven't been able to provide basic sanitation and electricity to the people, it is highly unlikely that the government would invest in this sort of technology to monitor its 1.3 billion people. But the more advanced countries might actually have to adopt this if the situation gets worse. So as sensible citizens of the world, it is our responsibility to make sure that we do not reach such a situation. And again, I think it is vital that we all acknowledge the contributions of medical staff and government support staff around the world that are working tirelessly in this hour of need to support everyone. You've all seen pictures on Instagram and Facebook where nurses come out from their shift scarred by all the masks that they've been wearing and looking dead. And let's not forget, it is their efforts that are helping contain this virus. So let's actively pray for them and support them in whatever way we can. They are the real heroes of our world today. But I also believe, like every other plague that has befallen mankind, we have the courage, we have the ability, and we have the strength to overcome them. At what cost, though, that is entirely up to us to decide. We can make a choice today. Let's also not forget the efforts of all delivery partners who work with Swiggy, Zomato and all that. These are the guys who are making sure that you get your food even during this time of lockdown and quarantine, right? And I think their efforts need to be recognized. We have the luxury of sitting at home, working from home, but these people do not. Delivery partners, doctors, nurses, medical staff, essential government support staff such as the police department, workers, the backbone of the infrastructure are the people who make sure that our lives do not get disrupted, that we have electricity at our homes, that we've got Wi-Fi, we've got connectivity, we've got food, while we have the privilege of sitting at home and remaining safe from the virus. So let's pray that the efforts of these people are recognized and also that they are safe as they go about their work, helping us pass our quarantine in a much better way. So, just wishing you all an amazing rest of the week ahead. Stay safe, stay indoors, and cheerio.